Donna, you are going to talk about Scotland, delivering health and care fit in the 21st century. Welcome.
Thank you very much, Agneta. I'm absolutely delighted to be here. I really, really love Norrbotten, and particularly Luleå. I've been here a few times, I have to say. The weather today is probably about the worst I've seen it here, but very entertaining yesterday arriving when the plane actually couldn't go to the gate. And they couldn't send buses for us because it was too icy, so we just had to take our chances and make our own way. But anyway, we're here. I'm actually here. I'm the second choice, I may say that. My colleague, Professor George Cook, should have been here. And for some of you who have heard George speak before, I'm sorry, I'm not George. He has a very unique style of delivery, and he always uses images to depict, you know, certain things that he wants to say. So I thought, well, rather than let you down completely, I'll set off with some of George's pictures. Is it me causing that? No. No. Don't you love technology? Carry on? Yeah, carry on. So, when George is talking about innovation, this to him is innovation. When he's talking about... Oh, will we try? This one? Is that better? No, it's not on.
It's off.
Right. Maybe I have some static or something in me that's causing it. Anyway, we're off. So this to him is service design gone wrong, clearly. And this is collaboration. We heard Veronica talking about collaboration. I think it's me. No. And this one, I have no idea what this one is, because I haven't seen. This is his latest edition. It's always animals that he has in them. I don't know what that one is, but I'll tell you. Maybe we should have a competition, actually. What do you think that one's about in the context of digital health? Who knows? Anyway, my brief today was just to tell you a little bit about what's happening in Scotland, but at a national level, because clearly you have Scottish partners in RemoAge project who are really delivering very, very innovative services on the ground, and they're going to be telling us about those later. But my brief today was really to tell you some of the national things that are going on, and I'm not covering everything, you'll be glad to know. But also just to tell you about some of the things that we've kind of learned along that journey, because we've been very similar to all of you in this room, working in digital health and care for a very long time. So our vision in Scotland, our health vision, our health policy vision, is really simple. It's that everybody is able to live longer, healthier lives at home or in a homely setting. It's very simple. All of us would agree with that. And on paper, and 2020 seems really close now, actually. When this came out, it seemed a very long while away, but it's not now. It's very much embedding integrated health and social care, a shift on focus to prevention and anticipation and self-management, and very much about treating people as much as possible out of hospital. Can we keep people at home and healthy and safe and keep them out of our hospitals? And again, that's very similar aspirations, I'm sure, to all of you. But what's really interesting about that is that for all the years that we've been working with welfare technology, with telehealth, telecare, now digital health, whatever you want to call it, it's the same thing, it's an evolution. What's really interesting for us is that we now have a very clear strategic commitment at government level to support digital technologies in the delivery of health and care. And I've been working in this agenda for quite a long time now. And although we've been very lucky, Scottish Government have always supported this agenda, we're really seeing it right up there now, written in strategy and policy. And I think for us that's a really important development. It's very important to have that high-level leadership over this agenda. As part of that agenda, not me anyway, but some of us in Scotland spoke to Scottish citizens about what they wanted, what would make them healthier and happier. And as you can see on there, all of it is actually very straightforward. It's about accessibility, it's about using accessibility to services, access to information, being able to do things online easily to access those services, and to exchange information and be able to exchange dialogue with health and care professionals at a distance. So it's all of the things that all of you in this room have been working on. So where were we? Well, this you'll recognise as well, very much previously a focus very much on treatment. It was all about treatment. And now it's very much focusing on that prevention, detection, independent living. So a real focus, shift in focus. In terms of models of care, we have that much more leaning towards empowering our healthcare professionals, our social care professionals, and less about the citizen. And now moving much, much more towards that empowering citizens. So for us, what that meant was really a shift in co-creation, co-design, working much more closely with citizens about what they wanted and designing services. And I have to say that we didn't really have an awful lot of experience in that. We didn't really know, other than saying, what would you like? You tell me what you'd like. We didn't really have real expertise in that. So for us, we really knew that we had to get into a very different way of working. And in Scotland, our first real foray into that at scale was a project that was funded by now it's gone completely out of my head, Technology Strategy Board, thank you, Donna, UK Technology Strategy Board, and it was part of a programme called Dallas. It wasn't the JR US Dallas, not the Tele Dallas. And it was a funding stream that was very much about looking at digital technologies to support independent living. And we got together this project called Living It Up. Now, Living It Up was promoting a platform for online self-management, and it was targeting people over 50. I've just had my 50th birthday, so clearly it's targeting people like me who are suddenly finding that their eyes don't work so well, they're not as fit as they used to be, and yeah, it all starts to go pear-shaped at that point. So it was about trying to make sure that we looked after ourselves more effectively and using technology to help people manage long-term conditions if they already had them. And for us, the difference about this project, one was that we were really going for scale, 25,000 users over the duration of the project. But the whole embodiment of the project was very much about this concept of co-design, co-creation, co-production. And as you can see on here, we had all sorts of technical partners at that side, all sorts of health, social care and independent sector, voluntary sector partners at this side, and the citizen right in the middle of it all. So it was a very different way of working for us, and we learned an awful lot through that project. This is just, I'm not going to dwell on any of this, but it was very much about that step up, step down, using digital technologies to promote that whole process. So was it a success? Well, yes, it was in many respects. It really was. It did generate preventative behaviours. We knew that it had the impact that we set out to, which was a very, very positive thing. But we also learned, I think, that there are real skill sets in co-production, co-design. It's not just something that you can do in one session. It's a mindset, it's a philosophy, and you need to get into it. And we really did learn a lot from that project. So what the lessons that came out of that project really were around the fact that you need to develop shared cultures across all of your sectors. So that's where you've got real cross-sectoral collaboration. And there were very different cultures at the start, and trying to learn what motivates different sectors and what their I suppose what they need to get out of something for it to be a positive outcome was really valuable for us. It really did improve relationships between citizens and staff, and importantly and vitally, families and carers felt more supported. So it was a good project for us. For us, what we also learned was you do need to involve the whole ecosystem, and that for us, Living It Up is very much embedded in communities. It's about community resilience and developing and supporting that. And that, again, really moved things away from the individual and made us realise that this is really important. So that ecosystem, and for my Scottish colleagues, there's loads of people missing on this, so there's lots of entities, and you're probably thinking, none of our projects are on here, but I ran out of space, I couldn't fit it on the slide. So this is a snapshot of our Scottish digital health and care ecosystem. So for us, going back to that national thing and about an ecosystem, these are all the sectors that are involved in that, many of the sectors, entities that are involved in the Scottish digital health and care agenda. And it's growing and growing and growing, which is a good thing. And what that's meant as, that it's really encouraged investment, further investment in innovation. So the whole ecosystem now is really driven towards that, improving, using digital technologies to improve health and care delivery. And as part of that, Scottish Government invested, along with other entities, invested in the creation of a Digital Health and Care Institute, which my colleague George Crooks now leads. So the Digital Health and Care Institute, there you go, there's its vision, to use innovation in digital health and care to contribute to that vision of keeping people at home healthier, longer and happier. And they identify problems, so key problems in health and care delivery. What are your problems? What can we try and fix? And they pull together different stakeholders to try and solve those problems and come up with new and innovative solutions. They also test new solutions, so that products that are ready to go onto the market, they need testing in a live environment, they can facilitate that and create evidence of impact, which is incredibly important. So for us, it's really exciting in Scotland because we now have a real home, I suppose, for our digital health innovation. These are some of the projects that they're leading on just now, so I'm not going to dwell on them, but if you want to know more, please do go and visit the Digital Health and Care website. This one on stroke reduction in digital, by digital atrial fibrillation, is using a little product like this, and I'm not touting it, but I have one, it's excellent. I have a little heart condition that I monitor through this. But we're actually rolling this out to 12,000 patients. It's a very cheap, low-cost solution, and it works. And I think that's pretty much what we're looking at in Scotland. We're looking at low-cost solutions which we know will work and you can scale up. This is another exciting one that we actually, in collaboration with our colleagues in the region of southern Denmark, it's using a CAM pill to replace colonoscopy. Very exciting stuff, and it's working incredibly well, and we hope to roll that out across Scotland. For diabetes management, we've done a lot of work in diabetes management and digital healthcare solutions in Scotland. And now what DHI are looking at is pulling those solutions together and actually enabling a suite of approaches to the management of diabetes in Scotland. Modern outpatient services, as I'm sure that all of you understand that there are real challenges around outpatient service delivery. And for us, again, this is about pulling together digital tools and services that can support that. And the final project that they're looking at, or suite or stream of activities, is around citizen-centred data. We're not as lucky as some of our colleagues sitting in this room in Scotland. We don't have one single electronic health record, and there's a lot of work going on in Scotland to try and address that. And the final one is around next generation asthma care. So again, using 5G technology that Netta referred to and looking at how we develop that. So the innovation agenda is running. It's all working very well. But for us, going back, this is when I started actually working digital health and care, way back in 2006 on the national Telecare programme. And in Scotland, we call Telecare, well, we call it Telecare, I think you may call it welfare technologies. So that programme was the first real investment programme for development of Telecare welfare technologies across Scotland. We learnt a hell of a lot from that programme, and it encouraged Scottish Government to invest in a new programme to replace it that spread out the reach of that programme into other aspects of digital health and care. And we've got 5 programmes running, that programme's still running, 5 key work streams. So you'll recognise some of these. We have home and mobile health monitoring. We're doing a lot of work on that. I'll touch on that in a moment. Extending the reach of our video conferencing, digital platforms, which is what we were talking about around the single electronic health record, expansion of Telecare, welfare technologies, and improvement and support. So I'm just going to touch on a couple of these because time is short. So for home and mobile health monitoring for us, we had a number of projects happening in Scotland, Telescott being probably the most well known at that time. And we started getting into collaborative projects in Europe, so EU-funded projects. And United for Health was the first major project that we got involved in. It was the largest home and mobile health monitoring project of its kind in Europe at that time. And we aimed to reach 10,000 patients across the partner organisations. Sadly, we didn't quite reach 10,000. We reached just over 7. However, that project really did reap rewards for the countries that were involved. And for us in Scotland, what was really important was all of the lessons learned from that really helped to inform the national programme that we now have for remote and mobile health monitoring. So these were some of the key things that came out of it. And for us, some of the things around strategy and policy were the fact that we needed at a strategic level to look at technology integration and the issues around that, and also around procurement. If you can procure cleverly, then clearly you can make savings. Stakeholder engagement and patient engagement co-production, again, the importance of that really came out of this project. Change management and marketing. That was incredibly interesting. You need to, when you got a product that you want to roll out and a service you want to roll out, you have to market it. And we weren't really very good at that in the early days. We didn't spend much time on that. And then clinical leadership, clearly you do obviously require that, because if you have clinical leadership behind it, then backed up by strong evidence, you can then really get ahead of the game. And our involvement in United for Health led to these guidelines. So we now have guidelines to support at-scale deployment in Scotland, and we have a national programme that's actually going incredibly well, thanks to my colleague Michelle Brogan, who's leading on that. For VC video conferencing, we have a national video conferencing network in Scotland that's been up and running for some years, and the technology enabled care programme really set out to extend that, but also extend it into citizens' homes and also extend the reach across social care, not just health. So that programme again has been running very well, and through a collaboration with our colleagues in Australia, we're actually now rolling out a service called Attend Anywhere. It's a product called Attend Anywhere, which is incredibly cheap by comparison to other VC services we've used in the past. You don't need to set it up as a preset. It's very, very easy to use. I'm not doing a sales tactic for it. But what I'm saying here is that it's incredibly important that you get products that are easy to roll out and people can actually use them easily. And this, for us, has been an incredible success. Going back to Telecare and the Telecare element of it, these are some of the things that we're looking at. Now, Telecare, as I say, we've been working on for a very long time. But we've run into quite a few problems with Telecare in terms of its expansion. And that's mostly due to the bottom one. Most of our services, in fact, all of them just now, are running on analogue services. And our major provider in the UK, BT, British Telecom, will be moving to digital services probably in the next couple of years. And we need to move those Telecare services to digital. So that's an incredibly large piece of work. Now, we know our colleagues in Sweden, I think you've already done that, which is you know, we've learned a lot from you. So that's a big thing for us. So this analog to digital switch for us is incredibly important, and there's a lot of work going on. So I suppose the thing about that is we've got innovation going on, but we're going back to basics here to try and fix those basic core services that work incredibly well on the ground, but the technology's behind the times and we need to adopt new technology. Our other one of the other streams of the Telecare project, and I really need to touch on this, is because it's being led by our partners called Alzheimer's Scotland. I think somebody's here from Alzheimer's Scotland today, are they? Yeah? Ah, yeah. Well, I didn't know you were coming, but anyway, here's a plug. The incredibly important thing about Telecare, and as we were saying, is this promotion and the marketing and the advertising. And our colleagues in Alzheimer's Scotland have spent a lot of time producing good quality products that really market this and help customers, service users, know how to access services and get away from that scary part of technology. They've done a lot of work on advice and support, and this is incredibly important. And the other thing that they've done is they've activated communities. They're doing a lot of work to make and encourage communities to be more supportive. And in the Telecare world, that's exceptionally important. It doesn't work. The technology can work, but it doesn't work if you haven't got the people element to go and help at the other end. And this is one of the great things that we're very proud of that's again come from them, this purple alert, which you can get on your phone, and it then notifies you if somebody with dementia has gone missing, and you can actually look out for them in your local community. So very, very simple technology, but it's been great. So I'll just finish up because I think I'm running slightly behind time. So the main lessons that we've learned from the Technology-Enabled Care programme are that you really do need to fit the technology into the environment that's being deployed. And we've learned that today. I mean, Agneta was talking about some of the problems in remote and rural areas, and we, you know, in applying technology. So it's got to fit. And it's got to be low cost, simple, web-based mobile technologies, because that is the way ahead. You can employ them at scale, deploy them at scale. And finally, my take-home messages, and again, I think I'm probably preaching to the converted here. It's not about the technology, it's about changing the way that we work. It's very different doing a pilot to scaling up. We know that in Scotland from the experiences we've had through other projects. And the low-cost bit, I've touched on that, but for us, interoperability and integration, we're at that point now in Scotland having to really invest in that, because that's probably going to hold us back from deploying some of the newer technologies that are coming out. So we're really investing a lot of effort in that just now. And finally, the 4 Cs: co-design, co-production, collaboration, and commitment to change. Very easy to say and not quite so easy to make happen. Anyway, thank you very much for your time and your attention.
Thank you very much, Donna, for an excellent presentation and lots of questions, of course. But please, during lunch and exhibition hour, take the chance to talk to Donna.